Welcome back to DXB Today, and tonight we've been talking about the pressures to look good. We've covered our teeth, we've talked about our psychology, and now it's to go to one of the biggest topics when it comes to beauty, which is skincare. And today we are very happy to have with us Dr. Amna Shah, a consultant dermatologist from the Genesis Clinic. Dr. Amna, thank you so much for being with us.
You're welcome. Pleasure to be here.
So we know that skincare is one of the biggest things that people talk about. How young are people talking about it now? Because I'm 32 and I might have just started thinking about cleansers and toners.
You'll be shocked to hear this, but I have patients who are as young as 7 or 8 years old coming in.
Is it their parents or is it them? They care about the skincare?
Believe it or not, it is actually the child. Now, whether that stems from the behaviour that has been modelled by the parents, it's hard to say. But it's the children who come in who've quite frankly said to their parents, we want to see a dermatologist. That is a good thing. It's great that they want guidance, but there is that level of self-awareness that they want to seek help for their skin.
So what's your best advice when you have a child or preteen coming and they tell you, oh, what's the cleanser that I should use? What's the toner that I should put next? What's my routine that I should have? What would be like a blunt answer where you really need to draw the line, put the dots on the letters and then, give them a clear explanation of the how and why?
Yeah, it's a really good question, and the answer to that is quite varied. It really depends on what's happening with the child. Now, when you enter kind of 10, 11 years old, there's a lot going on. There's obviously hormonal changes, there's puberty, and that brings along a whole load of dermatological issues, main one being acne. Then you've got pressure at school, so academic pressure, stress, sports, all of that's going to contribute to how your skin behaves. So a lot of young people who come into clinic come in with genuine concerns about their skin. The difference is there is a cohort of patients who come in with quite normal skin, you could say, who want a bit more perfection, or that kind of glass skin, the poreless, flawless look. That's when kind of alarm bells start ringing, and then we have to kind of work on a very basic sort of skincare routine. So if a child came in with quite normal skin, no kind of skin disease as such, I'd say have a really basic skincare routine. So cleanse your skin twice a day and opt for a gentle cleanser. So you're not going for the adult acne washes if you don't have acne. They've often got harsh ingredients in them. You're going for something that's hydrating, gentle, will clean the skin, a really lightweight, fragrance-free moisturizer, and then very importantly, a sunscreen. And I usually take the opportunity to talk about sun protection, which is so important, especially in Dubai, and the importance of reapplying sunscreen throughout the day and the benefits of that for the skin. So when I do have a child that comes in wanting a skincare routine or talking about products that they've heard about from their friends, I often take that as an opportunity to explore what may be going on in that child's life and seeing if they need to be referred to the right kind of channels, or using that as an opportunity to talk about how to maintain healthy skin and have a skincare routine which is great for the skin barrier.
You spoke about the glass skin, and it's something that I've been seeing on social media everywhere, and I know it's very big on TikTok as well, with the kids looking and wanting to have that plumpy skin and like all these products. I wanted to ask you, how reliable are these products? Because they're all over social media and you don't know if they're actually good for the child or not. Absolutely. So how can parents actually make sure that it's a good thing for them to try?
Glass skin is huge.
Yeah, it's all over.
Poreless kind of lack of texture of the skin.
Exactly.
It's really hard to achieve, and as it's been discussed already on the show, a lot of these images are completely filtered. A lot of the influencers have got ties with skincare companies, although they should be declaring that on the social media platform, but sometimes you wonder, do young children understand that? Business perspective as well. It very much is the parents' responsibility, and I would say parents should be involved in actually seeing what ingredients are in the creams and cleansers or what have you. They probably need to do a little bit of their own research, and if there is that kind of level of overwhelm, then get them to the right sort of specialist who can sieve through all the information that there is and create a really basic but skin barrier friendly skincare routine for them.
And I'm like,
It's a
you're
lot.
too young to have pores. Come on, you're like 10 years old. You're not supposed to have any pores at that
I'm
age.
worried about wrinkles.
Right?
It's
Speaking of
scary.
wrinkles, like there are a lot of kids, teens,
Yes.
preteens who are going to beauty stores like say Sephora, and they'd start buying all these really colorful looking products that actually have like anti-aging ingredients in them. How young should a person be to avoid anything that has anti-aging products?
So it's certainly, if you're in your kind of preteens or teens, you don't need anti-aging products. So the standard kind of over-the-counter retinoids, even the
yeah.
vitamin C's, they're really irritant to the skin barrier.
That's a big trend, actually.
it's a
Vitamin
very
C
big
for
trend.
teenagers are all over vitamin C
True.
serums.
Absolutely, and there's been big skincare brands that teens have really fallen into the, I'd say, trap of using. Because what's happening is I'm seeing younger patients coming into my clinic with irritant reactions. So these are skin reactions where the skin is literally peeling off, bleeding, getting infected, because they've just overdone it with the skin barrier. It's just not being required at all, and they've just been often trying to seek that perfect skin.
Yes, they're spoon-fed all over social media, telling them that this is how you achieve that look.
I don't blame them. Look, there's so much information out there. Even as an adult, it's overwhelming sometimes to go on social media platforms. You often come off it and think, I haven't been doing enough of this, and I need to, my skincare routine needs to include that because that's what's going to give me the glowy skin. So I hardly blame them for feeling so overwhelmed and under pressure when they're on these kind of social media platforms. Often there's peer pressure at school as well, and there's societal pressure as well.
Definitely.
So there's a lot going on. So if I do have a young person in clinic who has these concerns about their skin, it is, as I say, a great opportunity to reassure them that this is what a normal skin barrier looks like. There is texture, there are pores, you might have marks in certain places, and that's fine. And then take it as an opportunity to actually discuss just a very simple skincare routine.
Okay, tell me about some of the dangerous stuff that these looks-obsessed teens are doing when it comes to their skin without coming to the dermatologist at all.
Yeah, so there's always that kind of risk of injectables, and hopefully, I'd say in this city that's not the case, but I know around the world it has been a problem.
Yeah.
That I'd say the other thing is strong ingredients in skincare products, such as, so you've got exfoliants, so chemical exfoliants, widely available kind of at places like Sephora, which if you don't kind of follow the instructions properly can wreak absolute damage on the skin barrier. So you can end up over exfoliating, kind of using skincare ingredients which shouldn't even be used in the first place at the wrong time, going out without sun protection on, and again, you've wreaked complete havoc on your skin barrier. Facials, you've got to be really careful if you're having facials outside of the clinic setting. What does a facial include? What ingredients are included? Often it is harsh exfoliants. So it's these sort of things that I'm seeing kind of coming into my clinic as almost the aftermath, because then we're the ones who are treating kind of what's there in front of us.
Yeah, and it's all part of also teenagers seeking perfection.
Yeah.
And I think it's important as healthcare providers to transmit the message that, we're not, confidence doesn't come from cosmetic perfection, it comes from health. It comes
Absolutely.
from
So
a
it's something
healthy
that-
face.
Yeah, like you said, it's something that the parents need to work on with their kids,
Yeah,
for
yeah.
sure.
definitely.
Dr.
And
Amna, thank you so much for being with us on
Yeah,
today's
you're
episode. It's
welcome.
been a
It
pleasure
was-
to talk to you.
Pleasure to be here. Thank you so much.
Louis, we've got the Experience 60 right now. I don't know if you're ready for this.
We
It's a
do, we
surprise that
do.
we've got
I don't
here.
know if this is a surprise for you, Dr. Rafif, but we want to find out a little bit more about you in 60 seconds. Rapid fire questions, the DXB in 60. Are you ready? Your timer starts in
I have
3,
no choice.
No, you do not.
exactly 1. Best advice you have ever had?
Be yourself, Priscilla.
If you could have an AI assistant, what tasks would you want it to handle?
Oh, cooking, cleaning, housekeeping, organizing kids' schedules.
We really are moms. If you could have dinner with anyone, dead or alive, who would it be?
Oh, Priyanka Chopra.
Oh, nice. Which celebrity has the best teeth or smile?
Very interesting question. I think it's Julia Roberts. I love her wide smile.
Absolutely. Best way to unwind after a long day?
Oh, a walk on the beach.
Your go-to restaurant in Dubai?
Oh, home.
Oh,
A book, movie, or series you recommend?
I'm not much of a TV watcher. I like the TV series Firefly Lane.
Oh, gotta check that out.
Very old.
Only one more question. Why Dubai?
Dubai became home. Dubai. I feel like Dubai made me a better version of myself as a doctor, as an entrepreneur, as a business owner, and as a mom. Yeah.
Amazing. Dr. Rafif, thank you so much for being our guest co-host today. And of course, Dr. Amna, thank you so much for being on The Couch with us. We
welcome.
hope to see you again soon.
it's a pleasure.